Hi everyone, welcome back to Med-Surg Mentor. Air pollution is one of the world's leading risk factors for death. That is around 5 million deaths each year. High levels of air pollution can trigger various lung disorders. Along with this, lifestyle factors like smoking can cause lung disease by damaging airway and alveoli. Today let's discuss a disease from the respiratory system which is mainly caused by the above mentioned factors. And the disease condition is chronic obstructive pulmonary disease. Okay, let's begin. First of all, let's see the definition of chronic obstructive pulmonary disease or COPD. It is a group of lung diseases that cause an inflammatory reaction and irreversible damage in the lungs, which results in obstruction of normal airflow and breathing difficulty. Chronic obstructive pulmonary disease mainly includes two lung disorders, and they are emphysema and chronic bronchitis. Emphysema is the breakdown of the walls of the alveoli at the end of the bronchial tubes, whereas chronic bronchitis is the inflammation of the lining of the bronchial tubes. Etiology of chronic obstructive pulmonary disease. Tobacco smoking, which accounts for 90% of the risk. Environmental factors such as passive smoking, indoor cooking with poor ventilation, and air pollution. Exposure to chemicals, exposure to industrial dust and fumes, intravenous drug abuse, infections, and genetic disorders such as Marfan syndrome and alpha-1 antitrypsin deficiency. Stages of chronic obstructive pulmonary disease. There are mainly 4 stages, and they are Stage 1 mild, Stage 2 moderate, Stage 3 severe, and Stage 4 very severe. Let's see each one in brief. Stage 1 is mild COPD, and in this stage forced expiratory volume is between 80 to 100% of the predicted value. This stage is considered as mild and often missed, but lung damage begins in this stage. In stage 2, that is moderate COPD, forced expiratory volume will be between 50 to 79% of the predicted value. During this stage, symptoms worsen from stage 1. Coughing and mucus production becomes more severe. Next stage is severe COPD, and here forced expiratory volume is between 30 to 50% of the predicted value. During this stage, patient will have difficulty in catching breath and doing activities of daily living. In stage 4, that is very severe stage, forced expiratory volume is less than 30% of the normal value, and blood oxygen level will be very low. This stage could be managed only by surgeries. Now let's move on to the pathophysiology of chronic obstructive pulmonary disease. Due to etiological factors like genetic or environmental factors, there is damage to alveoli and lung structures causing lung inflammation. At the next stage, due to the repeated injury to the bronchial tree, there is infiltration of the inflammatory cells leading to airway fibrosis and narrowing. At the same time, the mucus gets collected in airway due to the goblet cell proliferation. Simultaneously, due to the lung inflammation, parenchymal destruction occurs due to the imbalance of endogenous proteinases and antiproteinases in the lungs. Thus, it leads to decreased alveolar elasticity, reduced structural support, and permanent alveolar dilation, resulting in air trapping, airway collapse, and hyperinflated lung with bullae, respectively. Finally, it leads to hypoxia and respiratory insufficiency. Clinical features of chronic obstructive pulmonary disease. Common clinical features are shortness of breath, especially during physical activity, wheezing, chest tightness, persistent cough, frequent respiratory infections, lack of energy, unintended weight loss, swelling in ankles, feet or legs, sleep disturbances, and fatigue. Now let's see the common diagnostic measures done to rule out chronic obstructive pulmonary disease. And they are pulse oximetry, arterial blood gas analysis, blood tests such as alpha-1 antitrypsin test, electrocardiogram, chest X-ray, chest CT scan, and pulmonary function test. Some of the common complications of chronic obstructive pulmonary disease are respiratory infections, pulmonary hypertension, depression, heart problems, and lung cancer. Next is medical management of chronic obstructive pulmonary disease. A variety of medicines are used to treat COPD, and they are bronchodilators, non-steroidal anti-inflammatory drugs, mucus thinning medicines, antibiotics for infection, anticholinergics, leukotriene modifiers, oxygen therapy, antihistamines, antivirals, expectorants, breathing exercises, and pulmonary rehabilitation. Next is surgical management of chronic obstructive pulmonary disease. There are mainly three surgeries, and they are lung volume reduction surgery, bullectomy, and lung transplantation. In lung volume reduction surgery, small wedges of the damaged lung tissue, usually about 20 to 30% of each lung, is removed. It allows the remaining tissue to function better. Second surgery is bullectomy. It is a surgical removal of the bulla, which is a dilated air space in the lung parenchyma measuring more than 1 centimeter. Next surgery is lung transplantation. It's a surgical procedure to remove diseased or failing lung with a healthy lung, usually from a deceased donor. Now let's see some of the preventive measures of COPD. And they are quit smoking, stay away from second-hand smoke, avoid occupational exposure to fumes and chemicals, use respiratory protective equipment at work, get annual flu vaccination, ensure good air quality, avoid exposure to air pollutants, make sure cooking vent is working properly, and make sure home is well ventilated. Next is nursing diagnosis for patient with chronic obstructive pulmonary disease. And they are ineffective airway clearance related to retained secretions, impaired gas exchange related to alveoli destruction, ineffective breathing pattern related to altered lung functions, imbalanced nutrition less than body requirement related to anorexia, risk for infection related to inadequate primary defense, deficient knowledge regarding disease condition, and activity intolerance related to dyspnea and fatigue. Now let's see some of the common nursing cares of patients with chronic obstructive pulmonary disease. And they are: assess respiratory sounds, oxygen saturation, and arterial blood gas values, ensure pollution-free environment, encourage abdominal or pursed lip breathing techniques, teach coughing and deep breathing techniques, suction secretions as needed, elevate head of the bed and have patient lean onto the overbed table, demonstrate chest physiotherapy, ensure adequate hydration, instruct the patient to frequently eat high-calorie foods in smaller portions, and administer supplemental oxygen. With this, we are finishing the review of chronic obstructive pulmonary disease. It is a chronic inflammatory lung disease that causes obstructed airflow and lung damage. Smoking is the main cause of COPD. We have also seen etiology, pathophysiology, stages, clinical features, diagnostic measures, complications, management, nursing diagnosis, and nursing care. Thank you so much for watching, and I would like to thank all my subscribers and viewers for your constant support. See you next week with a new topic from medical surgical nursing. Thank you.